So yoga is great for lengthening out the muscles and also for helping to get mobility back through the spine, for helping to stretch out the hamstrings and work on a really good standing posture, but also on a great posture that's helpful for the biomechanics of lung clearance as well. So if you stand up well, then you can take a deeper breath and you can clear your chest more easily, which is what we expect people with CF to do. Surprisingly, very little to date, and hopefully this is going to change in the near future. But so far there are 2 research studies that have been done. One has been published and one has been presented as an abstract at conference. They have been predominantly looking at the safety and tolerability of yoga for CF, as well as looking at benefits on a small pilot study, benefits on lung function as well as back pain, and they are both encouraging in the results that they have shown. They haven't been large enough studies to present any really significant differences yet, but they were pilot studies that are going to lead on to bigger studies, and hopefully they will come soon. So of course, before starting a yoga practice, it's always advisable for someone to speak with their clinician, their physio or the doctor, before starting practicing yoga. There are so many different types of yoga classes that are out there, and it can be quite overwhelming when you look at the timetable of a gym or a yoga studio with all these different classes, and you're wondering which one is right for me. Some yoga practices are a lot more powerful, they're stronger, they're more flowing, they're more dynamic. They'll be good for getting your heart rate up and for getting you breathing deeper and for giving you that cardiovascular benefit. But there are also classes that will give you some of that, maybe not to the same degree, but that are more focused on alignment. And those are practices like Iyengar and other alignment-focused practices, which will really help you build core strength to improve your posture. And I recommend that these are a good starting point. One of the challenges that people with CF may face is that a mainstream class may not be suitable for them. So if someone has cystic fibrosis and suffers with reflux or low bone mineral density, then the mainstream classes probably aren't going to be right for them. Because if you are doing lots of inversions, head down postures, then that reflux that you experience could then be aspirated into the lungs and cause problems. Also, if people have low bone mineral density, there are certain postures which you're advised to avoid if you have CF. So excitingly, in the UK, for the first time, we have a section that's being introduced to our standards of care document, and that's looking at complementary therapies for people with cystic fibrosis, and yoga has been introduced into this for the first time. And that's exciting because it really shows that there is a growing interest both amongst clinicians and people living with CF that yoga is something that they want to, that they're interested in participating in.